Welcome to the Board of Health Candidates Debate. I'm Anne Marie Mahoney, and I will be your moderator for this debate. Joining me today are the two candidates, incumbent Julie Lemay and challenger Michael Todd Thompson. Welcome. We're very happy to have you here, and I'm looking forward to a very interesting conversation with both of you. Before we get started, just a few rules for all of us to be following. As we ask the questions, we will start with the order that the two of you appear on the ballot. But then as we go forward, I'll be alternating who answers first and who answers second. So the two of you will be easy. It's a simple alternation. Couple of rules. We will give each of you 1 minute to answer each question. And should you, the other person, wish to make a rebuttal, you will have up to 30 seconds to do that. If you go over the allotted time in either the minute or the 30 seconds, you will hear a little ding, 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 and I will cut you off. And I might be smiling now, but I can be ruthless, so please don't go over. We want to get to as many questions as we possibly can, and with that in mind, we decided not to do formal opening or closing statements. We'll just get right into the questions and the information. So let's get started. Julie, we're going to start with you. What skills, experience, and/or ideas do you bring to the Board of Health?
Sure. So I have a background in public health. I am an environmental health scientist with a master's in public health from Boston University. I also have professional experience in environmental health. So for 20 years, I have worked in the environmental health field. 5 of those years was with the Massachusetts Department of Public Health, where I did community assessments. And I also have been on the Board of Health for 9 years, so this would be running for a 4th term. So I have a great working relationship with the health department and the other departments in town.
All right, thank you. Very good. Todd, what would you like to share with us?
Thank you. I am a graduate from the Harvard-MIT Division of Health Sciences and Technology. I have a doctorate in biomedical engineering and medical physics, and I attended medical school at Harvard Med. I have direct experience in a clinical setting, working with patients at the West Roxbury VA Hospital, with experience in infectious disease control, training under Judy Strymish. And it's that experience, the bench-to-bedside experience, that I think has given me a sort of a unique perspective in understanding both how to see problems from both sides, from a practical perspective, but also from a technical perspective as well. And it gives me, I think, an ability to approach challenges that the town is facing with a degree of adaptability and innovation.
All right, thank you. All right, so both of you bring really some excellent backgrounds here. This is pretty exciting and a great contribution to the health department. Todd, we're going to start with you for the second question. How do you see your role on the Board of Health and within the town in general?
What I have spoken about actually with Julie just yesterday is I would like to see the Board of Health begin to branch out and work with other committees and departments within the town itself, but also with other communities. I think one of the emerging ideas in public health is that there are a lot of aspects of individual health and community-wide health, a lot of aspects that are really outside of the control of the public health departments, but are nevertheless very important determinants of individual health. And so they require cooperation, things like stable housing, access to medication, things like this, mental health and social and emotional wellness training.
Okay, all right, good ideas. Thank you. Julie, what about you? What do you see as your role? You've already served on both the board and the town.
Sure, yeah, so I see most fundamentally our role is to protect and promote the public well-being in Belmont. And we do that in a variety of ways. One of the most visible things we do is restaurant inspections. So, all of us pretty much have some interaction with restaurants or even school cafeterias. So it has been important to me to, after COVID, where we were very much focused on public health, but from a COVID perspective, getting back to doing some of the more traditional functions of public health. So it's the restaurant inspections, it's rats, it's making sure that our budget is in alignment with the rest of the town, and like Todd said, working together with other departments to make sure that we're bringing all the services that we can to the community and trying to do that in the most fiscally responsible way.
Okay. Both of you have touched on topics that I already had planned to talk about in my questions. So, Julie, we're going to go back to you to start. Belmont has a growing senior population, and that population sometimes has growing needs. Can you identify the needs of seniors that you see from a health department perspective, and how might you be meeting those needs, or perhaps how might you work with Council on Aging and the Beach Street Center to address the needs of seniors?
Yeah, so the health department works pretty well with the Council on Aging. Currently, we have a social worker. The social worker was formerly under the Board of Health and is now moving over to the Council on Aging, and she will physically sit there to service the needs of the seniors. I think in addition to that, we do have a lot of unmet need for seniors in Belmont. I do a fair amount of volunteering too with Belmont Helps and other organizations in town, and I think that trying to increase the time that our social worker has to work with the aging population is important. We only have a part-time social worker right now, and I think that would be great to increase some of the budget there to be able to service seniors and the rest of our community with the rest of the time she has.
Okay, thank you. Todd, what are your thoughts on serving our senior population?
Thank you. Yeah. So I think that one of the things with the social worker, I think we need to try to find more funding to get more, at least another social worker, a full-time position there. I think that we should also work to increase community involvement with our seniors. Youth involvement. One of the most beneficial experiences of my life growing up was I had the opportunity to live with my grandparents in high school and help in the care of my great-grandmother. And it was probably one of the singular most rewarding experiences in my life. And I think that getting youth involved in working with our seniors, cooperating, and other members of the community is an untapped resource. But we're facing budgetary shortfall when it comes to having social workers, and that's something that needs to be addressed.
Okay, all right. You've both, just a very quick follow-up on my part, you've both mentioned budgets. You've mentioned that the existing social worker is only part-time. Do you see any way, maybe through grants or some other kind of outreach, to increase the budget or perhaps increase the social worker time that's available for seniors? And Todd, I'll start with you.
So coming in from the outside, I think it's difficult for me
That's a hard question, sorry.
to be able to speak authoritatively on that. But yes, I think we should be exploring every opportunity that we can, whether it's through grants, whether it's through working with businesses, local businesses, or even going to other towns and seeing if there's some sort of partnerships that we can form. Wherever we can look, wherever we can find someone to help, programs that we can create. We have a lot of bright people in this town, a lot of capable people, and I think that it's not a problem that we can't solve. It's just a matter of getting the people together to tackle it. So.
Okay, good. Julie, do you have any thoughts from your experience about additional funding?
Yeah, I think it's a great question. So one of the things that we did in the last year at the health department is get the Public Health Excellence Grant. And that's a grant that's offered by the Massachusetts Department of Public Health to sort of build workforce capacity and other capacity in public health departments in municipalities in Massachusetts. And we partnered with Arlington, Brookline, and Newton to develop the Metro Public Health Collaborative. And so that brought in a nice amount of grant funding. It allowed us to have a part-time public health specialist that we share with Arlington, and then Brookline has another position that they share with Newton. And that really helped us sort of fill in the gap, bring in some funding and also fill in the gap in the workforce that we had here in Belmont.
Okay, good ideas. Thank you. Following on a little bit on that same theme, but moving to the school department, the schools are seeing growing social, emotional, and health needs for their students. The school department presently is funding social, emotional personnel. What do you see as the role of the school department in providing for children and teens social, emotional well-being and health? And is there a place for a school health partnership? And this one, I'll start with you, Julie.
Sure. Yeah. So actually, just this year, the health department started a vaccine program that helps families who are just coming to Belmont and maybe are underinsured or temporarily uninsured get the children the vaccinations that they need to begin attending school. And that can be, visiting scholars, professors, people who have job transferred here and just kind of don't have their healthcare set up yet. It allows their kids to quickly get into school, kind of get the services they need. So our public health nurse has sought funding to do that. He has had really great success. I've been impressed at sort of how quickly this program has taken off and just how many appointments he had and how many kids he was able to vaccinate to get them to school quickly. So I think that that vaccine program is a great example of how we're able to support families, get them the vaccinations they needed, and also protect public health and well-being in the community by making sure that the kids in our schools have the vaccines that are required by the state.
Okay, very good. Todd, what are your thoughts?
So the question was on
On the social, emotional, and health issues that we're seeing in the schools. Where's the role for the Department of Health to dovetail there?
So I am also running for a position on the school committee as well, because I do believe that the Board of Health and the school committee should be integrally linked. I believe that they should have not just a say in how the schools are handling social and emotional and mental health with our kids, but that they should have policy influence as well. As you probably know, there are some unique challenges that the schools are facing right now. That parents, I'm a Belmont parent as well, with a child in the Butler Elementary, that we're trying to work through, and the schools are facing a tremendous amount of pressure, both staffing and budgetary pressures. And so I intend to advocate for the children.
All right, thank you, very good. Let's talk a little bit about disease. Citizens may not be as familiar with the role of the Board of Health in tracking diseases in town. Can you speak a little bit to that? I think most people are familiar with the tracking that we saw during COVID and the flu, and we were seeing all those charts and graphs and everything. But now that that's settled down a little bit, there's still a role there for the Board of Health. You want to talk a little bit about that? And I think, Todd, I'm starting with you on this one.
So I think one of the challenges in tracking disease for the Board of Health is that, and you can correct me if I'm wrong, but during COVID, there were some budgetary challenges there in being able to do something like contact tracing, right? So I think in order to at least begin to address that, we need to sort of aggressively go out into the public. And I'm not saying that the Board of Health hasn't, but go out, work with both private and commercial entities to train people in how to identify signs of illnesses, give them training on how to report to the Board of Health, how to contain infectious disease in their home until they're able to either call somebody to come and help or take their loved one, or if it's a business, call the Board of Health and ask for help and how to handle those situations. But it's going to require Sorry.
That's it. No, that's it. Julie, your thoughts on disease tracking?
Sure. Yeah. So we're fortunate in Massachusetts to have the MAVEN system, which is the state system for tracking infectious disease. So physicians, hospitals, doctors, infectious disease specialists are reporting these diseases, as they see them in the clinics. That information then gets pushed out to cities and towns. So we, as a board and the health department, are reviewing that information. So there's a whole list of reportable diseases, things like tuberculosis, influenza, certain stomach illnesses, norovirus, that sort of thing. They're on there. So we are pretty quickly able to see that information and act on it. We look at comparisons, year to year, month to month, kind of saying, well, this is unusual if we're seeing a certain uptick in a particular type of disease, and then we can sort of target our educational interventions to that. So whether it's a hepatitis outbreak and you need to educate food service workers, we have health department staff to do that, or getting out social media campaigns to let people know about norovirus, or making sure you're cooking your turkey properly, that sort of thing.
All right. In addition to infectious diseases, what many people don't know about the Board of Health is that you also track other diseases, so cancer, other life-altering diseases as, statistical within the town. Particularly, I think you keep records on causes of death. Can you talk a little bit about that? And I'm going to admit right here that I have a sort of a personal interest in this in my own neighborhood, where on my own block, I've lost 3 neighbors in the last 4 months, which is really kind of, stunning when you think about it. And not old, young people from serious diseases. Can you speak a little bit about disease tracking and how that might help all of us? And I think, oh God, now see, I've lost track of who's first. I think, Julie, you're first on this one. Thanks.
Sure. Yeah. So I think that is an important function of public health. The tracking of cancer that you mentioned specifically is tracked through the Massachusetts Cancer Registry, and that information is sort of held at the state level. You can call up the Massachusetts Department of Public Health, specifically the Community Assessment Program, which is where I worked for 5 years. And what that program does is specifically look at potential connections between chemicals in the environment, or sort of areas of environmental concern, and cancer patterns. Mm-hmm. So they can put all that information on a map, kind of look at it. Cancer is quite common, unfortunately. You have 100 different types of cancer, and 3 out of 4 families are impacted by cancer. It certainly is in the forefront of a lot of people's minds. So it is helpful to have the Massachusetts Department of Public Health that has the capacity, it has the epidemiologists, has people who can develop these very cool GIS maps and look at, the radius around certain centers and give us that information. So we have certainly reached out to departments to get that information.
To get that. All right, thank you. Todd, you may not have had the experience within the Board of Health, but it sounds like you do have some knowledge and experience about these kinds of diseases and tracking. You want to share with us your thoughts?
Yeah, and if I could just backtrack to the previous question a little bit as well, because I think they both touch on something. And that is just, again, what we were talking about yesterday in terms of the ability to acquire data and to share data. One of the concerns that I've had and expressed is that we've seen a drastic cut in funding and personnel at the federal level, which is putting really an unprecedented strain at the state and now local levels as well. And it's also making us have to question reliability of the data that we're getting. And we saw this a little bit with COVID, not so much in Massachusetts, but in other locations. And so part of the reason that I'm stressing the importance of our Board of Health going out into the community is...
I'm going to have to cut you off. That's okay. Following on that a little bit, the idea of hazardous stuff, hazardous materials, hazardous sites. I think everyone is aware of some areas in town that could be questionable. Mm-hmm. Is there a role for the Board of Health in inspections, in collecting data, in any aspect of hazardous materials? Todd, you'll be first.
Absolutely. I think that's a matter of public health. and to the extent that that those sites exist, and we can have people go out there to do inspections, analyze, collect data. Absolutely, yes.
Proactive.
Yeah.
All right, excellent. Julie, your thoughts?
Sure, yeah. So, with my environmental health background, obviously, I've been keenly interested in that issue in Belmont. So we had the Bradford development in Cushing Square where they had past environmental contamination there, and they were cleaning it up and turning it into a residential development. So I was very involved in that process, looking at all the reports, attending all the meetings, working with, there was a separately hired town consultant to also review the information. And I thought it was very helpful to have my background to help answer community concerns as they came up. Like people would say, is this, what the consultant is saying, is this valid? So it was helpful to look at that. I think going forward, we may have more development in town. It may be at sites that have, past industrial history. So it will be important for us to sort of keep on top of those issues, being responsive to community concerns about, sites, or as the development continues, if there's any, nuisance conditions, that's obviously something that we deal with. Yeah.
All right, thank you, very good. Shifting topics a little bit. Role of the health department with restaurants. I think one of you already mentioned restaurants, and that would also include school cafeterias, any place in town that serves food. You're the first defense, I think, and you're probably the first people that are called if a patron or a student has an issue. So would you like to share with us a little bit about the role of the health department with food service? And Julie, I think you're first.
Sure, yeah. So like I said earlier, I think inspection of restaurants is important because it impacts so many of us, us, our children, everything. The goal of the health department is for them to get out to inspect restaurants at least twice, so every restaurant in town should be inspected twice. During COVID, because of staffing challenges and the focus is elsewhere, we were not able to do that, unfortunately. But we have managed to get back to that, so we're about at 75% capacity in terms of places that need to get inspections. What takes up a lot of time often is re-inspections. So sometimes our staff will go out there, they'll see issues that are not compliant with the food code. They will educate the staff how to solve those challenges. They'll go back out, do another inspection if those issues still aren't fixed, or if they see new issues. They're out there again, kind of doing that education, going out there repeatedly, which takes a little bit of their focus from other things. But we've been doing a great job in building that capacity since COVID.
Okay, excellent. Todd, what are your thoughts on food service?
Yeah, no, it's a fundamental and important component of public health. I just want to say to business owners out there too, and this comes from my experience as being the chief lab safety officer when I was at MIT in my research lab. We're not in an adversarial relationship with business owners, and I feel like sometimes, just like with my my lab mates, they when I come around and inspect their chem bays, right? It can feel that way. We want to work with people, and it's a cooperative process. And it's all about just sort of promoting public health, making sure everything's fine. And so, inspections, re-inspections, all of those things are there. We're working with you as much as working for the public. And so, to the extent that you can work with us to make it fast and efficient, saves us time, saves us money.
Perfect.
We're in this together.
Thank you. Julie, what are your thoughts?
Oh, I already answered
We already
the rest.
did.
Oh,
See,
okay.
I'm going to be
I can tell you
fired
more.
because I
can tell you more.
That's fine. Moving on. We all were familiar during COVID with the vaccine clinics. The health department is still running a lot of very valuable vaccine clinics. Just speak a little bit about those clinics. What kinds of vaccines are you offering? Frequency? How are we getting the word out to people? And now I'm starting with you.
Sure. So we have recently partnered with Osco Pharmacy to offer, so their nurses will come in and offer clinics. Most of the clinics are being held at the Temple, up at the intersection of, what's that? Blanchard and
Concord Avenue,
Concord
yep.
Ave. And they have been very, very generous with their space to allow us to run vaccine clinics in there. It started during COVID. It's been fantastic to have places offer, free space to hold vaccine clinics right in the middle of the community is important for us. So yeah, typical ones like COVID, flu, that sort of thing. And then in addition to that, for children, catch-up vaccines from that program that our public health nurse has started running to offer those to children before they enter school has also been valuable. So if you need any vaccines, call our public health nurse, David Nalon, call the health department. They can point you in the right direction of when the next vaccine clinic is. We often will post that on social media in advance of the clinic, and it's pretty easy to sign up.
All right, thank you. Todd, your thoughts on vaccine clinic? You mentioned that you have a child. How can they be helpful in the community?
How can vaccines be helpful? So they are.
Well, the clinics.
Oh, the clinics.
Vaccines are helpful.
So the
We're
clinics
just-
are. Yeah. So vaccines. So clinics obviously providing vaccines. Vaccines are one of the most important tools we have in the prevention of the spread of communicable diseases. I just want to state clearly, I fully support vaccines, vaccination. I wish I didn't have to state that as a thing, but unfortunately, we're the times we're living in right now. I've been asked that question. So, and I'm sure Julie, you also obviously support them too. So yes, vaccine clinics, I'm for them. Again, not being on the Board of Health, I can't speak to which clinics are coming up in the future, but I don't intend to cancel any of them, and I would, fully intend to continue and expand if possible.
Okay.
So.
Just as a quick follow-up, part of what I was trying to get at is what specific vaccines are offered, or what do you see in the future? I mean, I think we're all familiar with flu and COVID, but are there other things that you do in vaccine clinics or that you think should be done? Other RSV or something?
So it's mostly COVID and flu that we're offering right now. I think the other one, there are certainly plenty of pharmacies in the area that offer other ones, like if you're looking for a hepatitis or pneumonia,
shingles,
yes.
Yeah,
Like
but I think we would refer people to either their doctors or one of the many pharmacies in the area if you're going for that. If there is something in the future where we need to quickly push out another vaccine, we deliver that to the community. We are pretty good at doing that. We set that up during COVID, and we're ready to do it again if something comes up related to avian flu or something like that.
Okay, Todd?
Yeah, so if I could, I think that one or a couple that I would like to see emphasized, the HPV clinics particularly because I know that in some communities, maybe not in Massachusetts, but in some communities, HPV vaccines have come under assault by certain interest groups. If avian flu, becomes more prevalent.
That direction.
Yep.
Okay, excellent. Thank you. I'm getting from my timekeeper that we're running out of time here, and I want to ask one last quick question of both of you, and maybe I'll just give you 30 seconds. If elected, where would you like to take the health department in the future? Do you have any kind of idea, something that you think is really important? Todd, I'll start with you.
Yep. Acutely, in sort of the acute phase, I think that we need to be very bold in affirming and protecting gender-affirming care as a matter of public health. That's currently under assault. I think that the public health department has a role in protecting that. I think in the long term, as I mentioned earlier, strengthening and building on a data management and acquisition and sharing program.
All right, I think I'm going to have to jump to Julie. We're running out of time here. Go ahead.
Sure, yeah. So I think continuing to seek opportunities where we can build workforce, particularly through collaboration with neighboring cities or towns or through grants. Like I mentioned, the Metro Public Health Collaborative, that was a great opportunity for us to partner, get grant funding, partner with neighboring towns, add some capacity that we wouldn't have had. I think in addition to that, just making sure that as a health department, we're getting back to the vital functions, the ones that are protecting public health, so restaurant inspections, tobacco inspections, helping residents with hoarding, fielding complaints, housing inspections, all of that, we have made really great strides in getting back to the level of service that we were providing before the pandemic,
Okay.
and now we're getting
We're there. All right. Thank you so much, both of you, for being here. Julie Lemay, Michael Todd Thompson. This has been Debate for the Board of Health. I urge everyone to get out there and vote on April 1st. Thank you.
Thank you.
Thank you.